Good afternoon. My name is Selwyn Willis. I'm one of the local podiatrists here in Longview, Texas. First of all, I want to thank Ms. Newhouse and the Ware School staff for inviting me to take part in this presentation in hopes to educate the community, particularly the African American community and other minorities, about the necessity of protecting their feet. After completing my secondary education, went on to undergraduate school where I received a bachelor's and then was trained in medical school as a podiatrist. I did a year residency in foot surgery and came back to join my father, Dr. Isaac Willis, who is with the Lord right now. I had the privilege of working with him from 1987 to 2011 when he passed away, and I'm continuing his tradition of educating the public, our patients, and even occasionally going into the community and sharing about the necessity of foot care. My again goal is to educate. Now, the way I start out doing that is by prevention. We see a high percentage of diabetic patients, people with poor circulation in their feet. Those are the people in our population that run the greatest risk of amputations. And part of my role is preventive care to help people keep their feet before it's their time to leave this earth. And one way of doing that is screening. So whenever we have a new patient come in, we check for their pulses just like you would in the arm before you take a blood pressure. Their pulses in the feet we check. We also check for sensation and feeling, since there are a number of diabetics that have loss of feeling in their feet. And we also check for deformities. Our specialty, we see quite a bit of foot deformity in the form of low arches, hammer toes, bunions, and our purpose is to prevent those deformities, again, from causing a greater issue later. Picking back up on some of what we look for in a foot exam, I did mention bunions and hammer toes, but there are a lot of other orthopedic problems with the foot that we screen for in an attempt to prevent further problems. And as I mentioned, we see a high percentage of diabetics and people with poor circulation. And we especially see this in the minority communities amongst African Americans and Latino patients. And what we do, again, we educate by explaining, Ms. Jones, your pulses aren't very strong, or Mr. Martin, this deformity could lead to ulceration, for example. And therefore, we order tests such as x-rays, we order vascular exams, we gather information so that we can get a better idea on how to plan for future care. The most common care that we do in the midst of what I've already said is skin and nail care. We see a number of people with thick nails, whether it's due to fungus, whether it's due to trauma to a nail from injury. We see corns and calluses, which is the result of deformities or even an infection. And so part of our preventive care is to look for those things, to debride them, to advise patients on medications that can heal these problems. We accomplish this by examining nails, skin. We watch the person walk. We determine whether they require imaging such as x-rays, vascular exams. We work quite a bit with the other specialties, including the vascular doctors, particularly if the patient has poor circulation. It's possible that they may have a blockage above the foot, and we are obligated to consult with the vascular doctor. That way they can conduct their own exam, arteriograms, those sort of things, venous Dopplers, that sort of thing. We work with the family doctor and internal medicine specialists, particularly with diabetics, in an attempt to prevent ulcerations. Also advise the patient on shoe wear. Again, with diabetics, we specialize in suggesting a type of shoe, particularly a diabetic shoe, which some of our podiatry group can dispense, or refer the patient to a medical supply facility, which would require paperwork on our part and on the part of the primary care doctor, which is the family doctor or the internal medicine specialist. A number of podiatrists, especially the foot and ankle podiatrists, they specialize in trauma. If there's a sports-related injury requiring repair, I do see local school athletes in case there's an ankle sprain, for example, or say a turf toe, that sort of thing. And we see a high percentage of senior citizens, those who have had bunions for a while and they want surgical correction. And we do the exam to make sure that they're able to heal adequately. But again, prevention is the best way to go for the long term, and we recommend our patients to follow up with us regularly, again, for prevention, for education.